Syphilis, often called the Great Imitator, has plagued humanity for centuries. Its origins remain shrouded in mystery, with theories pointing to either European or American beginnings in the 15th century. Regardless of its source, syphilis rapidly spread across Europe, leaving a trail of suffering in its wake. Early on, syphilis was a death sentence, characterized by horrific symptoms and a relentless progression. Over time, treatments emerged, evolving from mercury to the groundbreaking discovery of penicillin. Today, syphilis is curable with antibiotics. However, it remains a significant public health concern, with cases on the rise globally. Understanding syphilis, its symptoms, and the importance of treatment and prevention is crucial in the fight against this ancient foe. By shedding light on this often misunderstood disease, we can strive to reduce its impact on individuals and communities worldwide. Syphilis is a complex disease with various stages, each marked by distinct symptoms. The early stage, known as primary syphilis, typically appears within 3 weeks of infection. A painless sore, called a chancre, usually marks this stage. This sore can appear at the infection site, often the genitals, rectum, or mouth. Importantly, these sores are often painless and can go unnoticed. Alongside the chancre, other symptoms may arise. Fever is a common early symptom of syphilis. This fever may be low-grade and accompanied by fatigue, muscle aches, and swollen lymph nodes. These flu-like symptoms often lead to misdiagnosis, as they mimic other common illnesses. Recognizing these early signs, including fever, is crucial for timely diagnosis and treatment. Left untreated, syphilis progresses to its secondary stage, which is a critical phase in the disease's development. This stage typically manifests a few weeks after the initial chancre appears, even if the chancre has healed completely and seems to have disappeared. Secondary syphilis is characterized by a distinctive rash that can affect the entire body, including the palms of the hands and the soles of the feet, making it quite noticeable. This rash is often rough in texture, reddish-brown in color, and surprisingly painless, which can lead to it being overlooked or underestimated. Other symptoms during this stage can include fever, sore throat, swollen lymph nodes, muscle aches, headaches, and fatigue, which can be quite debilitating. These symptoms can be mild and easily mistaken for other common conditions, leading to misdiagnosis and further complications. Without proper treatment, syphilis enters a latent phase, where the symptoms disappear, but the infection remains in the body. During this latent stage, the absence of symptoms can create a false sense of recovery, making patients believe they are cured. However, the infection remains active and can cause serious health problems years later, affecting various organs and systems in the body. It's essential to understand that syphilis can remain dormant for years, even decades, before re-emerging in its late stage, causing severe damage to the heart, brain, and other vital organs, leading to potentially life-threatening complications. Fever, a common symptom in both primary and secondary syphilis, often presents as a low-grade fever, resembling the flu or other viral infections. This makes it easy to overlook or misinterpret, leading to delays in diagnosis and treatment. The fever associated with syphilis results from the body's immune response to the infection. As the bacterium, Treponema pallidum, multiplies in the bloodstream, the immune system releases chemicals that trigger an increase in body temperature. This fever, while often mild, should not be ignored, especially when accompanied by other syphilis symptoms. The presence of fever, along with a rash, sore throat, or swollen lymph nodes, warrants immediate medical attention. Seeking prompt medical care and being transparent with your healthcare provider about your sexual history are vital steps in ensuring timely diagnosis and appropriate treatment. Thankfully, syphilis is curable with timely and appropriate treatment. The mainstay of treatment is penicillin, an antibiotic that effectively eliminates the bacteria causing the infection. Penicillin is usually administered via injection, with the dosage and duration of treatment determined by the stage of the infection. For individuals allergic to penicillin, alternative antibiotics are available. Early diagnosis and treatment are crucial in preventing the long-term complications of syphilis. When addressed promptly, syphilis can be cured, and the risk of serious health problems significantly reduced. It's important to note that even after successful treatment, reinfection is possible. Therefore, practicing safe sex and getting tested regularly are essential for preventing the spread of syphilis. Section 6. Preventing syphilis, taking charge of your health. Preventing syphilis involves adopting responsible sexual practices and being informed about the risks. Abstinence from sexual activity is the most effective way to prevent syphilis and other sexually transmitted infections. However, for sexually active individuals, consistent and correct condom use during every sexual encounter significantly reduces the risk of syphilis transmission. Condoms act as a barrier, preventing the exchange of bodily fluids that can spread the infection. Open and honest communication with sexual partners about sexual health and testing is crucial. Regular testing for syphilis and other STIs is essential, especially for those with multiple or new sexual partners. Remember, knowledge is power when it comes to sexual health. By being informed and taking preventive measures, you can protect yourself and your partners from syphilis and other STIs. Section 7. The importance of testing and early detection. Early detection of syphilis is paramount for successful treatment and preventing long-term health consequences. By identifying the infection in its initial stages, healthcare providers can administer the appropriate antibiotics to cure the disease and halt its progression. Since syphilis symptoms can be subtle and easily mistaken for other conditions, regular testing is vital, especially for individuals at higher risk. These symptoms might include sores, rashes, or even no symptoms at all, making it easy to overlook without proper testing. Testing for syphilis involves a simple blood test that detects antibodies produced by the body in response to the infection. This test is quick, usually taking just a few minutes, and can be done during a routine checkup. These tests are highly accurate and can detect syphilis even in its latent phase, when symptoms are absent. Early detection through these reliable tests ensures that the infection is caught before it can cause serious damage to your health. It's essential to discuss your sexual history openly and honestly with your healthcare provider to determine your risk factors and the appropriate testing frequency. This conversation can help tailor a testing schedule that best suits your needs and ensures you stay healthy. Early detection through testing allows for timely treatment, preventing the progression of the disease and potential complications. Addressing the infection early can also reduce the risk of transmission to others, promoting overall public health. Remember, there's no shame in getting tested for STIs. It's a proactive and responsible step towards maintaining your health and protecting the well-being of your sexual partners. Regular testing and early detection are key components in the fight against syphilis and other STIs. By staying informed and taking action, you contribute to a healthier community for everyone. Section 8. Syphilis in the modern age. A continuing concern. Despite advancements in treatment and prevention, syphilis remains a significant public health concern globally. The disease, caused by the bacterium Treponema pallidum, continues to affect millions of people each year. In recent years, there has been a resurgence of syphilis cases in many parts of the world, including developed countries. This resurgence is alarming and calls for immediate attention from health authorities. Several factors contribute to this resurgence, including a decline in condom use, which has been observed particularly among younger populations. An increase in risky sexual behavior such as having multiple sexual partners and engaging in unprotected sex also plays a significant role in the spread of syphilis. Additionally, a lack of awareness about STIs, including syphilis, means that many people do not recognize the symptoms or understand the importance of getting tested regularly. Stigma surrounding STIs often prevents individuals from seeking testing and treatment, further fueling the spread of the infection. This stigma can be particularly strong in certain communities, making it even harder to address the issue. Public health initiatives focused on raising awareness, promoting safe sex practices, and increasing access to testing and treatment are crucial in combating the rise of syphilis. These initiatives need to be well-funded and widely implemented to be effective. Education and open dialogue about sexual health are essential tools in this fight. Schools, community centers, and healthcare providers all have a role to play in spreading accurate information and reducing stigma. By addressing the social and behavioral factors contributing to the spread of syphilis, we can work towards reducing its incidence and mitigating its impact on individuals and communities worldwide. Collaboration between governments, healthcare providers, and communities is key to making lasting progress. Section 9. Resources and further information. For more information about syphilis testing and treatment options, please refer to the following resources: Centers for Disease Control and Prevention, CDC, https://www.cdc.gov/World Health Organization WHO, https://www.who.int/Planned Parenthood, https://www.plannedparenthood.org/remember, knowledge is power when it comes to your health. If you have any concerns about syphilis or other STIs, don't hesitate to reach out to your healthcare provider for guidance and support.